Okay, now we are formally beginning with the session. I would just like to introduce the guest of honor today. He's Dr. Jayant Sharma, MS, DNB, MNAMS, and the Senior Orthopedic Consultant. Sir is the examiner for MBBS, MS, DNB, and FNB examinations for orthopedics. He is editor-in-chief of Indian Journal of Orthopedic Surgery, IGOS Journal. He has more than 15 publications to his credit. And Sir is the author of 3 books. One is The Examination Secrets. We would love to listen to hear about this even, Sir, from you. Then Essential Guide for Practical Orthopedics, along with Basic Principles of Elizaro Surgery. So here, Sir is there. I would like everybody to just greet him. Yes, all these students.
Yeah.
So
Good afternoon.
Good afternoon, sir.
Good afternoon, sir.
So welcome,
Yeah.
sir, and we hope to have a very fruitful session with you, and we would be benefited with your expertise and directly from the horse's mouth, what is the profession, the duties and the obligations along
The
with.
voice is quite breaking.
Is it so? Okay,
Yeah.
sir.
Will you please?
I'll try to just adjust it, sir, over here.
Yeah. There's an issue with the videos, I think. Audio.
Audio sometimes.
Yeah.
Uh,
Am I audible now?
yes, sir. Audible to everybody. Yes, all of you.
Yes.
Is sir audible to
Hello.
everybody?
Yes, sir. You are.
Okay.
Okay.
So
we
a
can
very good
just
afternoon to all of you.
Good afternoon.
Last time,
Good afternoon, sir.
Good afternoon, sir.
last time I had a chat with.
Yes,
Yes,
ma'am.
ma'am. Yes, ma'am.
Yes, ma'am.
Okay. Last time I had a discussion, sort of, with a few students of D and G section. Okay. And so today I'm going to speak to you people. Basically, it is in relation to one of your chapters, which is our doctor's life and his priorities. So there are a lot of things written in the book, a lot of things written in morals, duties, etc. about a doctor. But as such, if you see how a life of a doctor in a government setup and a private setup is different, a private practitioner has to go to the hospital for his visits. Then he goes to his chamber where he looks after the patient, and then he has to, if he's a surgeon, he has to operate. If he's not a surgeon, he has to take care of the emergencies, which he has observed in his OPD that way. A government doctor has even more responsibilities because he has to attend all the patients of the government setup, not specifically of his specialty. Then he has a duty towards teaching the students who are coming to the hospital and so on and so forth. Basically, the duty of a doctor is to be a good listener, not a good speaker. Hardly any doctor will find to be a very good speaker, but they all are good listeners. If you listen well to your patient or the attendant, a lot of things get cleared, what is going on in his mind, then what is the psyche behind the patient's disease and how he is going to get improved. So if he is a good listener, he can solve a lot of problems of the patient. Coming on to other duties, duties are towards the society, duties are towards the patient, and duties are towards the family of the patient as well as his own family. So the duties of doctor towards his society is to enlighten, inform, both. Inform the authorities. For the first corona case which has come to Indore was the duty of the doctor who first saw and observed. It is the duty of doctor to be well read. He has to read so that he comes to know about the different new diseases and how that patient is going to present in front of him in the chamber. So that is one of the duties of a doctor, that he has to be well read and then observe the patient and inform the authorities if he's finding anything wrong in that patient, or is something like a patient of tuberculosis has to be reported. Had we not, the doctors not reported the patients of polio, the polio would not have got eradicated. It's that simple. Okay. So next is duty towards the society. The society is, again, a doctor has to teach just not the patient, but also to the family members and in the society where he's living about the healthy lifestyle. There are a lot of videos on how to, and PowerPoint presentation on how to take care during this crisis of coronavirus. All prepared by doctors, circulated in WhatsApp groups. Basically for what? Just to make the society aware of the disease and the problems. Then there is duty towards the family of the patient, again that comes in society. And last is duty towards his own family. A doctor is risking his own family if he is taking care of patients who are sick. He can be a carrier for a disease like corona when he comes home. A duty towards himself is to take proper PPE kit wearing during the OPD and operation, and coming home taking all the precautions and sanitation measures. Then why doctors have to have all these duties, etc.? It's because we have taken a Hippocratic oath. A Hippocratic oath is conferred on to the students when we finish our MBBS and internship. Then there's a candlelight ceremony during which we are conferred upon this oath in front. It's the old tradition now, being this type of society where we are wanting more Indianized things. We are changing from the candle to Indian tradition dresses and all that. But yes, Hippocratic oath is a oath which binds us to work with the society and fellow doctors as well as the patients. So it is a duty that we don't have to disclose the problems of a patient to anybody. The next person sitting should not know what problem your patient has shared with you. You have to be a good listener. Then I come home. Hina ma'am does not know how many patients and what difficult patients I have seen. That is not divulging the information of the patient even to the family members. Then we are not supposed to charge our kins. That means the kin is the family of other doctors, your own doctors and paramedics. So this is what is there inside the Hippocratic Oath. There are certain rules that we have to follow, that we don't have to advertise. We don't have to have the boards in a clinic to be very huge. We don't have to take all those measures of using Facebook and WhatsApp and all that to publicize yourself. These are certain rules which have been laid down in the Hippocratic Oath also. Then coming on to one of the things, that is COVID-19 situation. I mean, you all might have had almost hundreds of videos, hundreds of WhatsApps, hundreds of PPTs telling what is to be done and what is not to be done. Basically, think of one thing. If there is a virus, it's going to multiply even faster than the bacteria. It's going to spread very fast. And to have a fight with this virus, we have to have a good immunity. And a good immunity, again, we are coming back to the Indian method of treatment, is coming back to yoga. That is increasing your immunity by yoga, doing breathing exercises, having a healthy, normal diet, not the junk food. We all have survived the 45 days of no junk food happily and healthily. So this is what I think I was wanting to convey to you people. Washing your hands, using sanitizer, using mask has been publicized by the Prime Minister up to the local leader also, and from doctors to teachers. Everybody is telling this. If anybody has any other question to ask.
Yes, students, you may proceed with the question answer session. Sir, I would like to ask you one thing.
Yes.
Yes, sir. Sir, as the name suggests, it is called as Hippocratic Oath. So doesn't the word is itself ironical, because, you know, if it is related to something, hypocrisy or something like that, or this is purely a different...
it is a totally different thing. Hippocrates was a Greek physician. He is considered as father of medicine, modern medicine. And on his name, these rules have been laid down, which are known as Hippocratic Oaths. Hippocrates, he was a Greek person.
Okay, sir. So one more question. Have you ever got stuck in any of a dilemma or the condition where you were supposed, couldn't take the decision, and it was so difficult being a doctor to save the life? So what type of mindset you have that time, or the qualities are needed to keep you calm?
Keep calm, I think so, it is God gift. And it comes with the rigorous training that we get during these 10 years of MBBS and PG. So we have situations where it's just not dilemma, there is aggression of the patient also, which is a problem. Yes. You operate on a patient, he gets infection, he comes and tries to hit you. But then the best thing, again, one thing is there, in that situation also, communication is the best thing. If you are very clear with the patient, what is this and what is going to happen and what has happened, he is not going to be angry. Next is coming on to a condition where I am in a dilemma. I think so, this happened recently. I had a patient during a COVID-19 shutdown. He had a fracture around his hip joint. My gut instinct told me that I should not operate onto this patient. Maybe it was a God-sent, you can say, instinct that, no, you should not operate. Still admitted the patient, went for the investigations and found out that he was an untreated diabetic since last 6 years. And his blood sugar was at the range of 600, which normally should have been 120, 140 something. So that gut instinct made me to go in for some further investigations, avoided the surgery, and the fate should, as the fate be, that patient died 2 days after. We didn't operate at that time. That could be a blessing sorts for us. And the patient had a painless death. That was another thing. But yeah, these situations do come. And I always feel that it's good that if you keep on talking to the patient and the family.
Sir, does such situation disturbs you sometimes?
That Hina ma'am knows better. That Hina ma'am knows better how it affects me in the home. It does affect. Yes. And I become irritated, agitated, both.
But sir, I have personally visited you to many a times, and the way you try to, make the environment so lively for us, that the way you talk, your vividness and everything, it develops a faith between the patient and the doctor. So that gives us the strength, and then we can open up before you, and then we are relaxed when we leave the clinic. That is the best part I have observed. So this is really commendable, sir.
Thanks a lot.
Yes. Anybody who would like to ask anything related to the profession or something what sir has shared?
Hello, sir. I just want to ask, how do you manage your professional life and personal life?
The personal life is never managed. I'm always at the receiving end from the ma'am side. I hardly have time for her. Because the time when I come home, it's around 8:30 in the night. And the time after dinner, I want to sleep. Whole day I have been listening to the patient, so I don't want anybody else to come and tell me something. I just want peace and calm atmosphere at home. But that's not possible every day.
But the best part is, sir, Hina, it is never reflected on Hina ma'am's face. She's so happy and jolly that it never seems that she faces such problems. That is, I would give credit to you even because, definitely when you create that environment at home, then obviously everybody is happy and satisfied.
Yeah.
Yes.
But yeah,
Anybody?
she is always supportive.
Yeah. Yes. Ishika, any question from sir? Anything related to the profession, I would say?
Ma'am, I just had a question that looking at the current situation, there are only government hospitals which are being used for the treatment of the people who have COVID-19. So
No,
I
that's not true.
guess,
That's not true. It's the government hospitals. One wing is only used for COVID-19 patients. That is MRTB hospital. There are 3 zones. One is a red zone hospital, one is a yellow zone or orange zone, and one is a green zone. Green zone hospitals operate and treat all those patients who are non-COVID and having other problems. Like just now, I'll be going from here to a hospital to operate upon an ankle fracture. Okay, so that is, I'm going to operate in a green zone hospital. But then Arvindo and Index Medical College, Gokuldas Hospital and Synergy Hospital, apart from MRTB, these are red zone hospitals which have only COVID-19 patients. And orange zone is Suyash Hospital, Arihant, that way. So orange has suspected patients that these could be COVID positive that way.
okay.
Any other question, Vita? So one question from my side again. So like when you get the patient, I think I'm the
Yes.
most interactive person right now. Rest of you, please think of some questions. Sir, I would just like to ask, like when you have patient before you, do you ever
Yes.
think of the nationality or to which caste or creed or religion the person belongs to? Or it's only a human.
No, it becomes it's just a patient and nothing else. Like my maximum patients are from the secular community, which is being targeted this time. My maximum patients come from that community, and I daily get a lot of calls from them. But it's not like that I'm not going to attend them. It's not the nationality. I mean, it's not the color. It's not the religion which is going to affect the treatment. Again, that is the Hippocratic oath, if at all we want to follow.
Yeah.
Most of us, we do. We have that sympathetic approach towards the disease and the patient. It gets inculcated over the period of time.
Okay. Sir, in the oath, you have told that you don't disclose problem of the patient with to anybody.
Yes.
So, like if the patient himself wants to know the entire thing, would you be very choosy with the words to express, or would you be straightforward to
We
tell?
have to be. We have to be, because in the day of spy cams and recorders and mobile recording, everything, we have to be very cautious about what we are going to speak and what prognosis or what further things we are going to tell the patient about the future or the treatment, etc. Because litigation is coming up in a bad way.
Yeah.
The doctors are litigated for a smallest of thing. Like even if I say a patient to be given a plaster for 6 weeks, and if the fracture is not uniting by 6 weeks, and it has to be extended for further 2 weeks, the patient can go in. If we have told him 6 हफ्ते में हड्डी जुड़ जाएगा, if you say something of this sort, you are in a soup.
Okay. Any other questions, Swanan, Manas?
Good afternoon, sir.
Aryan, sir.
Yeah.
Sir. Yeah.
So I wanted to ask that, do you build a personal relation with the patients? So as seen in the movies like Munna Bhai MBBS, that they say that we don't have to build some personal relations with the patients because we get nervous. So is that true, or you build some personal relations?
You see, personal relations do develop if the patient is coming for a lot many times. You know, we can write serials about Saas Bahu Kissas if we just try to sit and talk about. We have all those old ladies coming with different joint pains, telling about everything in their house. So ultimately, because of that, when they come for the next visit, we definitely ask, how is your daughter-in-law now with you? That type of personal relationship do develop.
So does that make you nervous when you're treating the patient?
No, it becomes a cozy atmosphere for both of us. The patient is also comfortable because of this, and we are also comfortable that we know this patient's total history. See, when we are examining a patient, the first thing we do is ask a history. What is a history? History is basically knowing everything about that disease. We have 4 sections: the history of disease, the past history, the family history, and the personal history. So we know how is he addicted towards tobacco, alcohol, etc. We know about his diet also. That comes in the personal history part. The family history, we know what is going on in the family. Is he having a relative who's going to give him a psychological trauma, or there is somebody who's having tuberculosis? Family history again in this COVID time is important. If somebody is coming with cough, cold, fever, were you in contact with a relative who's having COVID positive? That way. So that history part makes you connected to the patient totally.
Thank you, sir.
Okay. Yeah.
Any more question, Vita?
Yes, ma'am. Yes, ma'am.
Tanav, you want to ask something?
Yes, ma'am.
You're not audible.
Hello,
Yeah.
ma'am. Now, am I audible?
Yeah, you speak loud.
Sir, will you hesitate if you operate on your real ones like
We don't
sibling?
operate. We don't operate. It's also in the Hippocratic Oath.
Okay. Okay, sir.
Okay.
Anybody else, Vita?
Ma'am, I have a question.
Yes, please proceed.
Sir, if you are given responsibility to eradicate coronavirus out of India, so what will be the best option according to you?
Best option. I'm an orthopedic, but yeah, definitely. See, ultimately, it has to come with immunity. We have to focus on herd immunity. Herd immunity means a colony has everybody with good immune status so that they can fight the virus. So we have to have vaccines any day. Vaccines improve the immunity. I just vouch for early appearance of trials of successful vaccine available.
Thank you, sir.
Yes, Manas, you are there with some question, I suppose. Kshitij, would you like to ask something?
Sir?
Yeah. Manas?
Yes, ma'am.
Yes.
I have a question. Sir, hello.
Yes, Manas.
Uh, Sir, my question is that if you get a patient from Pakistan who is an illegal immigrant and he is injured, what would you do first? Would you treat him first, or would you give him to police or army?
He has read the chapter, ma'am.
Exactly. He has just changed the nationality.
Yeah. So, listening to madam's lecture today, I could guess what is the chapter about. Yeah, see, we have a system. We get criminals from India also. For that system, we have something called as.
Prerak,
Could you mute?
yes.
Hello.
Prerak, everybody please mute the microphone except sir. Please, everybody. Yes. Rishabh, please mute it.
Yeah.
Yes, sir. Please continue.
So even in India, if we get criminals, so-called supposed criminals, we have a system called medico-legal register. So what we do is we file a medico-legal report, we start the treatment and send the medico-legal report to the police station, the nearest police station.
Okay,
So
sir.
that way, both the duty as well as duty towards the patient as well as the society is taken care of. The treatment should never stop.
That is what we talk about, the universal human values. That
Yeah.
patient first and then later whatever is needed.
Whatever it is.
Yeah, exactly. Anybody else with the question?
Excuse me, ma'am. I have a question.
Kshitij, yes, you want to ask something?
Yes, sir. I have to ask that what kind or which type of doctors are used to treat coronavirus?
See, usually they are physicians and epidemiologists. See, there are different departments, like there is a department of community medicine. The people of community medicines are basically those people who work in the field with the patients and the society and the family members, etc. Then there are doctors who are physicians, MD physicians and chest physicians who take care of these patients of COVID, because main involvement of COVID is in the lungs. So the physicians, MD medicine, MD chest, these are the people who take care of these patients.
Sir, I have a doubt.
Yes,
Yeah.
Prayer.
Sir, is this necessary for an orthopedic surgeon to go for a round for a red zone hospital?
Orthopedic surgeon to go for a round. May I know
Yes, because as my father is also an orthopedic surgeon.
Yeah, I could understand what is the problem. So he's still going to the hospital, yes.
No, he was asked to go for Aurobindo hospital for a round.
See, if in the medical colleges, when you're in a government job, it becomes compulsory for doctors to go, but not to the red zone wards. He has to go to the hospital and only to be involved with his patients. But on papers, it is legal. Otherwise, he can very well skip it.
Okay, sir. Thank you.
Okay, ma'am, I have to leave now.
Yes, thank you, sir. It was
Thank you
really,
very much.
really nice to have words with you face to face, and the way you have satisfied the questions with your diplomatic answers. Sometimes that I love the most. The way you answer very clear, honestly, everything, and I think most of the queries have been satisfied by you. And thank you so much for sparing the valuable time and being the part
Thank you
of
very
this
much.
Zoom class. Thank you so much, sir.
Thank you. Thank you.
Thank you, sir.